Okay. Another episode here at TNT Weekly. Really happy that I'm here at the Mill Pond Med Center, and I just want to start and say that as you've seen on YouTube, all of my podcasts are being broadcast out of the Gibson Center, and I really want to thank them very much for giving me that opportunity. But I just had to be in the house here, and my guest today invited me into her offices, and as you can see in the backdrop, I just love this scenery here. So thank you again. And Gibson Center, remember, without arts and culture in the community is just there's nothing there in the community, all right? Think about the Gibson Center for future events. I know things are tightening up, but they're super, super safe with their guidance and everything. Have any small parties or functions, they're the great place to host it. They have an arts and craft scenario going on till December, and December 12th, great visitor at the Gibson Center, Santa.
Okay.
Santa's coming to town, all right, at the Gibson Center and everything. So book that up. It's probably very close to sold out, but remember, Santa coming to town December 12th at the Gibson Center. So as you can see in the backdrop here, it's a little bit cloudy today, but you know what? Every time I'm with this wonderful woman here, it's sunny out, in my opinion anyway, all right? And she's brought sunshine to this medical center in Alliston, Ontario, the moment she stepped in through the doors. And she's got an amazing program that she had brought forth to me, and it just really captivated me, and I started reading into it a bit. And we're just going to focus today on reading and the importance of reading, all right? And what that can do in a perfect parallel to maintaining good health. I was not aware of that, so it's really wonderful. So my guest today is the amazing Dr. Fatima Mahdi is in the house today. How you doing?
I'm great. Thank you so much. Those are very kind words from you, Antonio. And I'm so fortunate and privileged to be working at the Mill Pond Clinic and to be one of the new physicians in Alliston. This is really a great community, honestly. I want to introduce myself by saying that I am a newly graduated family doctor. I recently graduated from McMaster University in Hamilton, and part of my residency program, we had to do a rotation out of the main cities, so out of Hamilton, out of Toronto.
Yes.
And I ended up somehow in Alliston, and I worked with amazing people here, Dr. Khalil, Dr. Myatt, and the team at Stevenson. I fell in love with this cute little town, and I decided to move up here after I was done, and here I am.
Yeah, well, thank you for that intro. You're right, and one of the purposes of this podcast is really to promote how beautiful this town really is and how special it is with everybody in it that brings it all together, the fabric. So Dr. Mahdi here is part of that fabric. We're blessed. These professionals, they love our community, they fall in love with our community, bam, and they've been, they're staying, they're not going anywhere, right?
Yeah.
But let's get into this reading, this ROR program that you had talked about, and you know, you had mentioned that it was a very successful program in Hamilton, right,
Yeah.
where you implemented it and where it was implemented, and what you want to do is you want to take that theory and that proven success and bring it here to your patients and part of your care program. Please start off a little bit, sort of the introduction of what this is and the importance of it.
Absolutely. So I trained, like I said, I trained in Hamilton, and one of our academic sites. Part of our residency program, we had to do a quality improvement study. And it wasn't me who actually did this study. It was one of my colleagues, and I'm going to give her a shout out, Dr. Rachel von Steen. She brought up this idea of giving baby books to parents who bring their babies for well baby checkup, you know, and these are done when the babies are very young, so 2 months, and at 4 months, at 6 months of age, and on.
Yeah.
And so she partnered actually with Hamilton's Public Library, where they provided us with free books, a library card. And so all of the clinicians at McMaster Family Practice have the opportunity to give out these books and introduce reading to your baby. which was to some people shockingly a bizarre idea, and people loved it. The parents, Rachel actually did a quality improvement study, so she actually surveyed those parents before giving them the books, and then after giving them the books, and asked them to read the same book, say, to the baby until the next visit.
Yes.
And the parents reported, far more bonding with their babies. They really enjoyed their time reading to their babies, which was, initially to them a bizarre idea.
Yeah.
And so, I gave the books to a few patients I had in the clinic, and the results, the happiness, it just made my day.
Yeah.
And so, but it's more than just, it makes your day that a patient walks out of the clinic happy. It has proven benefits. And so what I want to bring to the Mill Pond is the same idea. I was hoping to partner with a public library where we can get some baby books, and they have to be developmentally appropriate.
Yes.
We have to keep in mind that babies don't have the same vision as we do.
Yes.
They're practically blind when they're born.
Yeah.
So they focus more on faces. So faces and texture books, board books, those kind of books work best for the babies. And often it's hard for parents to bond with babies or to talk about everyday life when you're talking to someone who's nonverbal.
Yes, yes.
But the books provide such a good activity for the babies to learn these vocabularies that are introduced to their daily lives. And I can go on about how well documented this is in literature. The Americans actually implemented this first. The ROR program model is the same model. They were giving books to these families who brought their babies for well baby visits at pediatrician offices. Yeah. And these babies, they've shown that these babies grew to be smarter, they had better bonding with their parents, and the parents felt that they were actively enrolled in the baby's life early on.
Yeah, yeah.
And most importantly, it actually improved literacy rate for these children growing up. And so by the time they were in grade 3, they had scores that were phenomenally different than those moms or parents who didn't read to their babies.
So the reading aspect at infancy, at 1 month, 2 months, 3 months, the brain obviously is consuming and listening to this. There is a parallel of better literacy and scores in school, etc., with that relationship of reading to them. Is that correct?
Absolutely.
Yeah.
So the babies are phenomenal creatures. They're born with, I want to say billion and trillion of neuronal connections. And actually, as a baby, you make so many connections that you don't ultimately sustain growing up. Only those that are stimulated or worked on are preserved. So it's kind of like, use it or lose it kind of idea.
Ah, okay, all right. So these neurons in the brain, if the way to activate them and make use of them to improve cognitive skills would be to read out loud to them, right?
Exactly.
And give that sensory action in their brain, right?
Exactly.
Very interesting. You emailed me some points because, again, I'm new to this, all right? And maybe you could sort of expand a bit on them, and I think they're very key points. Parents want information from physicians about learning. Nearly 1/2 of parents do not read daily and believe it would be helpful to discuss literacy with their pediatrician. Now, you're not a pediatrician, right?
No, yeah, but those are the American studies most of the time.
Yes.
And so they're based on pediatricians, but it's the same for primary care providers anywhere, really.
Yeah, so your passion is in infants, right, as a primary care physician. So this is telling me that parents are looking for that guidance, even though it's something very simple, and you think schools are doing it automatically for you, and you think that level of reading is sufficient. Truly, it's not, right? And the direction coming from a physician is something that this is what you want to do to reach out to the community to inform them, right?
Absolutely. So I think as physicians, we have a huge impact on our patient population. And I mean, we think the best impact we can make is actually early on in childhood and infancy.
Yeah.
And so we're talking before these kids even get to school.
Mm-hmm.
I'm talking about babies that are 2 months old, 4 months old, 6 months old babies.
Mm-hmm.
And so that kind of impact, to the parent from a physician is truly remarkable. It's almost like giving a prescription to a patient about a medication, except this works better than any medication without any side effects.
Yeah, and really no cost.
And really at no cost, almost no cost.
Yeah.
Exactly. So in general, patients feel that they can make a huge difference if they were given direction by their physician. So, and I sometimes say this, when I encourage patients to exercise, I say something like, I wish I could prescribe exercise for you, because I know you would be more likely to stick to it,
That's
to do
right.
it.
Yeah, that's right.
If it was a prescription.
Yeah.
So that is how we should think about reading aloud to babies and to our kids, is to think of it as a therapeutic and actually the most important intervention and parent-child activity they could do together.
Okay, wonderful. No, I get it. Parents often place more importance on reading to their children when a book is given by their pediatrician or physician. So emphasizing again what you had just mentioned. If that direction seems to come from the family physician on please read, right? The direction to read and following up in reading typically happens, right? Is that really the sense there? So the distribution of books enhances the effectiveness of literacy intervention beyond what is achieved by anticipatory guidance alone, which would be the school system
and just saying read.
Right.
I could easily say to patients, oh yeah, you should read for your baby, but the impact of giving them a book and asking them something like, this is going to be your homework for the next 2 months until we meet.
Yes,
and then I want you to kind of follow up with me and tell me how it went. And so the patients and families are more likely to engage in that activity and more likely to report back, oh yeah, we actually read the books, oh they my children love the books, and I hear some families tell me, for example, I have an older child who reads to the baby now. They've learned that reading is really a crucial part and an activity that they can all engage in, and actually evidence shows that reading out loud, especially the reading that includes the dialogue. So, when you're reading a story, and guess what happened next?
Exactly.
And then the child kind of responds.
Yes.
And even I've seen babies respond with this, with excitement. They have these leg movements and
Yes.
smiles and things like that. And so that really adds in that social interaction piece as well, in addition to the cognitive improvement.
Wonderful. So in your schooling, Dr. Mahdi, when you go through college and your schooling of learning, is this something that's brought up in the teachings of medical school, or is this something that was sort of put together by your peers?
Yeah, so I honestly haven't come across this in my medical school training. I came across this, like I said, through this project that my colleague did during residency, and I found it immensely beneficial. So really, it is recommended by the American Academy of Pediatrician to include these teachings and these habits into residency programs and things like that. So I'm really glad that I was exposed to it early on, so I can give that opportunity to my patients. And I'm hoping to start this project at the Mill Pond, and so with the support, I'm hoping that the public library can accommodate our needs and give us some books that we can give to the patients in the clinic.
Okay, well, I got something for you right now. I spoke to the mayor of our town. This guy is always accessible, so I gave him a call this morning, and I told him that I was meeting with you, Dr. Mahdi, and your initiative on this ROR program. And all you have to do is give the mayor a call, and he'll set you up with the meeting of the chair of the library, all right, to talk about this program that you want to implement. Basically, what Dr. Mahdi wants to do, library people that are in charge, is providing books. here with a library card in it. So it's sort of a two-way street. It's also promoting the library, literacy, etc. And again, supporting this program that you want to implement. Maybe, am I right in that?
Absolutely. And I think the key point with giving the books is I want the kids to develop a relationship with the library. I want the library to be a good place, a favorite place for the kids to go to and to read and explore. It's really, it should be accessible to everyone. And we see this impact on kids growing up with their literacy rate, with their test scores, with how they end up in life later. Mostly significant in families that are of low socioeconomic status. And so this even pushes us more to do more for these families and to bring, they call it in the States, bring out these kids from the poverty line.
Yes.
And set them up for success. And really, success starts when they're born. And so.
And something as simple as reading.
As reading.
So is there, I read here in one of your reports that you had sent me that there's actual data linking health to literacy. Can you sort of expand on that a bit?
Absolutely. So, as a physician, I can tell you that from my experience, it takes a lot more time and effort to explain a disease or a condition or a medication to a patient with low literacy than it takes to someone who's highly educated, and therefore this really impacts their health. It impacts how they comply with physician visits. It impacts how they comply with their medications, how they understand their conditions. One of the important things we talk about in medicine is insight, and by that I mean patient's insight. It's really that you're in charge of yourself. And if you don't know enough about your condition, or you don't know enough about your medication and how to take them, this can impact how well you do in life and how well you respond to the treatment, to the medications and things like that.
Makes total sense. What about, I was thinking of your program and, children's books, etc. And tell me if I'm totally wrong or this would not be something that you would like to see, but what about maybe a channel of, parents that are empty nesters now and they have beautiful little children's books that they would like to give away and for something that could be used for something like this. I think there may be many situations like that. Is that something that you would look at, Dr. Mahdi?
That would be definitely an interesting project. I think the only drawback to things like donation from people and things like that would be is we're in COVID.
Yes,
era,
the sharing of things,
and the
sure
sanitation
and
side. It might be problematic in that sense, but I think it's definitely something that we can look forward to.
Okay, well, if this is something that's really of interest to you, and you have books that you'd like to donate, channel out to my socials, and we'll just find a way to sterilize them or do something, but. I think in this period of time that we're going through will come to an end, and we can look at that. But that's a channel. But I think the library is something pretty exceptional that can happen, and I really hope it can. And my wife Lisa read to my son all the time.
Oh, amazing!
All the time, and the gazillion books there. And one of the books, I want to give you your first book. All right. And this book is Tony Baloney, because that's what they called me in public school. Tony Baloney. That was my kind of nickname. Wonderful little book out of the many series of books that Lisa read to Diego. And if I look back on raising Diego, Lisa's reading, I feel, had quite a bit to do after better understanding this program with you and the importance of literacy and the importance of reading. So thank you for educating me in that area as well. So the first book, may I present this to you?
Thank you so much.
And I did sanitize it with hand sanitizer, okay, and everything, all right?
Thank you so much.
Superb. So have I missed anything?
No, I think that's great. I just wanted to thank everyone in this community, all my colleagues, all my supervisors who supported me to come here. And all my patients. This is a tough time for everyone, and so I appreciate how accommodating you are. You know, things in medicine have changed dramatically after COVID.
Yeah.
And so, you know, the lengths that people go to reach out to their doctor, you've given up coming to the clinic with just a phone visit or a virtual visit. And I so appreciate that from you. And I know it's hard on you and on me as a physician, because we do like that patient-doctor interaction in person. And so I hope we get to a time where I can get to meet all of you again in person without masks, hopefully.
Yes, absolutely. Well, I tell you, we're blessed to have you, Dr. Mahdi,
Thank you so much.
and like I said, you're a ray of sunshine every time I see you. It doesn't matter if it's cloudy, it's always sunny around this beautiful woman.
Thank you.
So that's it. Remember, read, okay? Just read to your little guy, all right? It's really healthy, inexpensive, right? And good for the soul, good for the health, and in the big circle of health for raising your little ones, right? And Dr. Mahdi wants to bring this program in. I'll be putting it on my socials. Flip it around, get the word out there. And if you have problems with that library, give me a call. I'm just going to call the mayor, okay? All right?
Thank you so much.
All right, over and out. Thank you. See you on the next show of TNT Weekly.
Thank you.
Bye-bye.
Thank you, Tony.
Okay. That was it. Wasn't that good?
Was it good?
Hey.